Hello, and welcome back to Navigating Possibility. I'm your host, Dr. Christina Adams. Today, I want to talk about a concept that I think is deeply misunderstood in medicine, especially among women physicians, and that is self-compassion. Because for many of us who've been raised in the culture of medical training, self-compassion sounds like letting yourself off the hook, lowering your standards, being soft when you should be pushing harder. And if you trained in medicine, you were very explicitly taught the opposite. Be tough, be resilient, suck it up, don't complain, just handle it. So when someone says you need more self-compassion, it can feel irritating or dismissive or completely incompatible with the reality of patient care, productivity metrics, call schedules, and ethical responsibility. That's why I want to talk about fierce self-compassion, a concept developed by Kristin Neff, who wrote a book called Fierce Self-Compassion. She is one of the leading researchers on self-compassion, and this is important. Fierce self-compassion is not about being passive. It's not about putting up with mistreatment, and it's definitely not about staying silent when something isn't working. In fact, it's the opposite. So I want to talk a little about why self-compassion feels so uncomfortable in medicine. Most women physicians I work with don't struggle because they don't care enough. They struggle because they care deeply. They overfunction, and they carry emotional responsibility that was never meant to be theirs. We were rewarded all throughout training for self-sacrifice, for pushing through exhaustion, and for minimizing our own needs. So when burnout shows up, the reflex is often, what's wrong with me? Instead of what's happening around me. Kristin Neff defines self-compassion as having three components: mindfulness, noticing suffering without exaggerating it or suppressing it; common humanity, remembering you aren't alone or defective; and kindness, responding with care instead of criticism. But in fierce self-compassion, she adds something crucial. She talks about two energies of compassion: tender compassion and fierce compassion. And medicine is very familiar with one of these, just not when it's applied inward toward ourselves. So tender self-compassion is what we usually think of: comfort, understanding, soothing, gentleness. This is the voice that says, of course you're exhausted, this is hard. But fierce self-compassion is different. Fierce self-compassion says, this is not okay, and something needs to change. It's protective. It has boundaries. It has anger sometimes. It has clarity. Think about how you advocate for a patient when something is unsafe. You don't say, well, let's just be understanding of the broken system. You say, no, this patient deserves better. That energy, that's fierce compassion. The problem is women physicians are incredibly skilled at directing fierce compassion outward and almost never allow themselves to direct it inward. But women physicians especially need fierce self-compassion. So Kristin Neff points out something that matters a lot here, and we've talked about this before. Women are often socialized to be agreeable, to avoid conflict, to put others first, and to absorb discomfort quietly. So when we talk about compassion, women hear endure more, be nicer, try harder. But fierce self-compassion is not about endurance. It's about self-protection. It asks questions like, what is this costing me? Where am I overriding my own limits? Where am I overfunctioning, overgiving? What am I tolerating that I wouldn't want for somebody that I love? For physicians, this might show up like staying in a job that's eroding your health because patients need me so I can't leave. Accepting chronic understaffing as normal. Feeling guilty for wanting fewer clinical hours. Or silencing your own grief after a bad outcome. Fierce self-compassion says, my pain matters too. It says, I don't have to set myself on fire to keep others warm. So there's a myth that a lot of women physicians sit with, and that's, if I'm compassionate with myself, I'll stop performing. This is a big fear. Many physicians believe if I stop being hard on myself, I'll get lazy. If I'm kinder to myself, my standards will slip. If I don't push, everything will fall apart. And Kristin Neff's research shows the opposite. Self-compassionate people take more responsibility for mistakes. They have greater emotional resilience. They're less afraid of failure. And they act more sustainably over time. Why? Because shame is not an effective long-term motivator. Most of us aren't running on inspiration. We're running on self-pressure. And that works for a while until it doesn't. Fierce self-compassion doesn't remove accountability. It removes self-abandonment. So let's talk about what fierce self-compassion looks like in real life. Let's make it practical. Fierce self-compassion might sound like, I'm allowed to be upset about this, even if others think I should just be grateful. This workload is unreasonable, and I don't need to justify my limits. I can care about my patients and still choose myself. I don't need to prove my worth through suffering. It might mean doing things like saying no without over-explaining. No is a complete sentence. It might look like taking a medical leave that you need to take for an illness without shame. Leaving a role that no longer aligns with your values. And naming anger instead of turning it inward as self-criticism. And here's an important distinction Kristin Neff makes. Anger isn't the opposite of compassion. Indifference is the opposite of compassion. Anger, when it's grounded in care, is information. It tells you where something matters. Burnout is not a personal failure. You've heard me say that before. It's not a personal failure. It's a boundary violation. This is where fierce self-compassion becomes radical because it reframes burnout. It's not a lack of resilience. It's not a mindset problem. It's not a personal weakness. It's often the result of chronic boundary violation. Fierce self-compassion says, I'm not broken. I'm responding normally to something that is unsustainable. And that opens the door to a different kind of question. Not, how do I push through this? But what would it look like to protect myself here? Sometimes the answer is small, sometimes it's not. It's usually uncomfortable, but at least it's honest. So I want to offer you a brief reflection, self-compassion practice. Maybe not while driving, but sometime this week. Take a deep breath, hand over heart, breathe in for 4, hold for 4, breathe out for 6. And then ask yourself these questions. Write about them in a journal and really sit with them. Where in my work or life am I overriding my own needs? If someone I loved were in my position, what would I want for them? What emotion am I not allowing myself to feel because it feels unprofessional or selfish? And then this question, which is very much in the spirit of fierce self-compassion. What am I being asked to tolerate that I no longer want to normalize? You don't need an answer right away. Just sit with those and think about them. You need permission to ask yourself things like that, and I'm here to give it to you. I named this podcast Navigating Possibility for a reason. because possibility doesn't always look like a dramatic exit. Sometimes it looks like renegotiating, redefining success. You get to decide what your definition of success is. Other people don't get to decide that for you. You get to decide that. It can look like reclaiming parts of yourself you had to silence to survive training. And fierce self-compassion is not about burning everything down. It's about telling yourself the truth about your limits, the truth about your values, and the truth about what you can and cannot keep doing. And trusting that listening to yourself isn't selfish, it's wise. If this episode resonated, I want you to know this. You do not need to earn rest. You do not need to earn rest. You do not need to justify your humanity. And you do not need to be on fire to be valuable. Sometimes the most compassionate thing you can do is to refuse to abandon yourself. Thank you for being here, and I'll see you next week on Navigating Possibility.